This one's pretty cool. Something you don't see very often. So a basaloid tumor, but not a basal cell carcinoma. When you come down in here, you see very sharp, punched out lumens, some secretion inside, some blue myxoid material, and if you're lucky, you'll see kind of a reduplicated basement membrane appearance, but the very sharp, circumscribed, punched out spaces. So I think this fits well for a real, true example of adenoid cystic carcinoma. Very rare to see as a primary in the skin, but it does happen from time to time. I have seen one example, which I think maybe going to be presented at the American Society of Dermpath by one of our residents this year. But an example of an adenoid cystic that looked classic for adenoid cystic and merged with an area that looked more like spiroadenoma cylindroma. Really, I'd never seen another one like that. Very interesting case. So in the salivary gland, adenoid cystic carcinomas are problematic because they tend to be infiltrative, have perineural invasion, and can really cause problems for the patient. In the skin, the behavior is indolent usually. They do need excised with negative margins. And the other important thing is to make sure that it's not a metastasis. Now, I've not personally seen a skin metastasis from a salivary primary, but I think it's rare enough that it's worth probably having a head and neck exam to make sure they don't have an occult salivary gland tumor. The other thing is if this is anytime you have a salivary gland tumor or a sweat gland tumor that is on the cheek or preauricular area or even the neck, always think, could this actually be a salivary gland tumor growing up into the skin? And so then you can do imaging or physical exam, have a ear, nose, and throat otolaryngologist see the patient potentially, just to make sure, because the treatment implications are different. So in these tumors, though, once you've excluded metastasis, the behavior is very good and indolent for these in the skin, different than in the salivary gland. So this is as opposed to basal cell carcinomas often get cystic change, what we call adenoid change. I don't know if I have one scanned. But in adenoid basal cell carcinoma, the cystic spaces are usually very irregular, filled with mucin, kind of all sorts of different sizes and shape, whereas in true adenoid cystic carcinoma, very sharply circumscribed, punched out, like perfectly round, usually, and sharply bordered by an area of pink kind of cuticle around it. Okay, it's an adenoid cystic.